So let's talk through how to do a self-check to see if you might have some separation of your abdominal muscles called the diastasis recti abdominis. It's pretty easy to do. Just lay down flat on your back with your knees bent up. The little pillow under your head is totally fine. You want to make sure you're directly on skin. It's a little easier to feel. So if you've got pants or shirt on, just try to pull them up out of the way so you have direct contact onto your skin. First thing you want to do, obviously, is find your belly button. That's where we're going to start this process here. So it feels a little funny at first, but go ahead and put one or two fingers in the belly button. And first, just go in until you get to some resistance. Okay, so you should be able to sink in a little bit into the tissues until you start to feel like, yeah, it's getting a little firm. And from there, you're going to maintain your finger position and lift your head up off of the table. And then you're going to check to see how many fingers do you feel in between those two muscle bellies. So here's one muscle belly, here's the other. There's a little gap in between that you should feel. Is it one finger? Is it two fingers? Or is it more fingers? So you can kind of measure based on where you feel those edges on the muscle belly. That's the first step. How wide is it? So, is it one finger, two fingers, three, four, or more potentially, depending on your circumstance? So get an idea of how wide it is. Now, the other thing you also want to do is feel how deep it is. Okay, so if you're pushing here and it's about one finger, how far down can you go? So this is my muscle belly, and I can sink kind of far. So I'm measuring how far down my finger is, and that tells you how deep that gap might be. So it's important to see how wide it is, but also how deep to see how much your core can help engage and correct some of that fascial tissue that's been stretched a lot during pregnancy. So that's checking width and depth at belly button. We also want to assess it up a little bit higher because obviously these muscles are not just in one spot, they're all the way up and down. So once you find the center, that's the easiest. Just come up a few inches and recheck. Is it still one finger or is it two? How deep is it? And then come about an inch or so down below and do the same thing. Can you feel separation down lower? And how wide is it? How deep is it? Now, usually this separation down lower is not as extreme, so you feel the most of it usually around belly button. You may feel some moderate amount up above the belly button, but usually below it's minimal. So you can check that at different areas to see how wide it is. Now, keep in mind that this is going to change a lot during your postpartum experience, and even throughout the years after you've had a baby, depending on what you've been doing, how well you've been training your core, how tight you might be in other areas of your body. So this is always a super flexible way of measuring. So don't get super concerned that one day it's three fingers, and then a week later, or even the next day, it's one and a half, or it's four fingers. It's going to change a lot. So you're going to use this to help check yourself. You can do your first postpartum check on yourself if you'd like. You can check, a couple months down the road. You can check a year down the road. What I wouldn't want you to do is check this every day. That's a little bit too much. And keep in mind that this measurement here does not necessarily correlate to how much dysfunction you're going to have in your pelvic floor, how much pain you're going to have in your back. Um, there's no correlation really between how this diastasis, how big it is, compared to your dysfunction elsewhere in the body. But it's just a nice way to check and to see how well your body is healing postpartum. But don't do it every day. Just do it periodically, once a month maybe, and see how it's progressing. If you can't find it, that's when you want to ask your physical therapist to check for you and just monitor these issues.